Now let's go to treatment of bipolar disorder. Most people with bipolar disorder, even those with the most severe forms, can achieve substantial stabilization of their mood swings and related symptoms with proper treatment. Because bipolar disorder is a recurrent illness, long-term preventative treatment is strongly recommended and almost always indicated. A strategy that combines medication and psychosocial treatment is optimal for managing the disorder over time. Medications known as mood stabilizers are usually prescribed to help control bipolar disorder. Several different types of mood stabilizer are available. In general, people with bipolar disorder continue treatment with mood stabilizers for extended periods of time. Years. Other medications are added when necessary, typically for shorter periods to treat episodes of mania or depression that break through despite the mood stabilizer. Medications for bipolar disorder include the following. Lithium, the first mood stabilizing medication approved by the US FDA for treatment of mania, is often very effective in controlling mania and preventing the recurrence of both manic and depressive episodes. Anticonvulsant medications such as valproate or carbamazepine also can have mood stabilizing effects and may be especially useful for difficult to treat bipolar episodes. Newer anticonvulsant medications, including lamotrigine, gabapentin, and topiramate, are being studied to determine how well they work in stabilizing mood cycles. Generally, children and adolescents with bipolar disorder are treated with lithium, but valproate and carbamazepine also are used. There is some evidence that valproate may lead to adverse hormone changes in teenage girls and polycystic ovary syndrome in women who began taking the medication before age 20. Therefore, young female patients taking valproate should be monitored carefully by a physician. Research has shown that people with bipolar disorder are at risk of switching into mania or hypomania, or of developing rapid cycling during treatment with antidepressant medication. Therefore, mood stabilizing medications generally are required, alone or in combination with antidepressants, to protect people with bipolar disorder from this switch. Lithium and valproate are the most commonly used mood stabilizing drugs today. As an addition to medication, psychosocial treatments, including certain forms of psychotherapy, are helpful in providing support, education, and guidance to people with bipolar disorder and their families. Studies have shown that psychosocial interventions can lead to increased mood stability, fewer hospitalizations, and improved functioning in several areas. A licensed psychologist, social worker, or counselor typically provides these therapies and often works together with a psychiatrist to monitor a patient's progress. The number, frequency, and type of sessions should be based on the treatment needs of each person. Psychosocial interventions commonly used for bipolar disorder are cognitive behavioral therapy, psychoeducation, family therapy, and a newer technique called interpersonal and social rhythm therapy. Cognitive behavioral therapy helps people with bipolar disorder to learn to change inappropriate or negative thought patterns and behaviors associated with the illness. Psychoeducation involves teaching people with bipolar disorder about the illness and its treatment and how to recognize signs of relapse so that early intervention can be sought before a full-blown illness episode occurs. Psychoeducation may also be helpful for family members. Family therapy uses strategies to reduce the level of distress within the family that may either contribute to or result from the ill person's symptoms. Interpersonal and social rhythm therapy helps people with bipolar disorder both to improve interpersonal relationships and to regularize their daily routines. Regular daily routines and sleep schedules may help protect against manic episodes.